So in this station we are going to talk about alcohol withdrawal. इस स्टेशन का दूसरा नाम सीवा ए भी होता है. सीवा ए इज योर अल्कोहल विड्रॉवल स्केल. ओके, सो पर्टिकुलरली ये जो फॉर्म है वो आपके गवर्नमेंट ऑफ साउथ ऑस्ट्रेलिया का है. ओके, एंड दिस इज फ्रॉम द ड्रग एंड अल्कोहल सर्विसेज. ओके, और इस फॉर्म के अंदर आपको वो पेशेंट मिलते हैं जो अल्कोहल पी के छोड़ चुके हैं और अब वो शायद विड्रॉवल में है. So you need to assess the patient that whether this patient is, at risk for alcohol withdrawal or not. So let's start the session. So guys, आपको स्टेशन करने से पहले अल्कोहल विड्रॉवल के जो है वो सिम्टम्स जो हैं वो पता होने चाहिए, साइंस पता होने चाहिए. What are the signs for alcohol withdrawal? So let me tell you the signs. The number one sign is orientation. The number two withdrawal symptom is, the patient is suffering from nausea and vomiting. The number three is basically the patient is experiencing proximal sweating. Number four, patient is experiencing tremors. Number five, patient is experiencing agitation and anxiety. And number six, patient is experiencing, tactile dysfunction or disturbance. Then visual disturbance, and then tactile, visual, auditory disturbance. So these will be the signs of alcohol withdrawal. तो ये स्टेशन तो बहुत सिंपल सा है, आप देख सकते हो फॉर्म के अंदर भी लिखा हुआ है. तो सबसे पहले ओरिएंटेशन पूछोगे आप, उसके बाद आप चले जाओगे एंजाइटी, और उसके बाद एजिटेशन का पूछोगे, फिर आप पूछेंगे उसके खाने पीने के बारे में यानी नोजिया वॉमिटिंग, फिर आप ट्रेमर्स पूछोगे, प्रॉक्सिमल स्वेटिंग पूछोगे, और अब आ जाती है बारी साइकोलॉजिकल सिम्टम्स यानी कि टेक्टाइल, ऑडिटरी एंड विजुअल. दैट्स ऑल. हेडेक आपका भी फिजिकल में आ जाता है. तो गाइज दैट्स ऑल. यही आपने पेशेंट को पूछना है. अगर वो पेशेंट किसमें क्या एक्सपीरियंस कर रहा है, अगर वो पेशेंट आपका अल्कोहल विड्रॉवल में है, तो दीज आर द पॉइंट्स यू हैव टू आस्क. सो लेट्स परफॉर्म दिस स्टेशन. You will read the scenario outside the room. That patient is suffering from alcohol consumption last 6 years, and recently since 6 months he have not taken any kind of alcohol. He is in clinic, and but he currently is experiencing nausea and vomiting frequently from past 3 days. You are the nurse on shift. Go and do the assessment. You will close the door. You will look for the scene safety. You will look for the sanitizer, hand sanitize. Hi, your introduction. Hi, my name is Vaishali. I'm just a nurse looking after you. How are you? This how are you is basically acknowledge. So you will acknowledge the patient. You ask the patient, how are you? How are you feeling? You feeling great? Okay, that's fine to me. Now, if the patient says, yeah, I'm good. If patient says, I'm not good, then guys, you need to calm down the patient. You can use these trick points. Please calm down. My name is Vishali, as mentioned earlier. I'm here to help you. Okay? Don't worry. I'm going to make everything confidential. I'm not going to share with anybody else. Okay? And secondly, I will also make sure that if my questions irritate you, bothers you, I will stop my assessment. Okay? So please don't worry. अभी भी patient नहीं मान रहा है. अब क्या करोगे? Please just calm down, relax down. Okay? I'm here to help you. I need to ask you a few questions because then only I can help you. Okay? Because I need to collect some data so that I can share that with the physician, and we can create some good beneficial plan for you, management plan for you, so that we can help you as you're experiencing nausea and vomiting, right? Yeah. So please just cooperate with me, okay? But before doing anything, I just want to confirm your name and your date of birth. So can you please confirm your name? Okay, your date of birth. Your MR number is this. Do you have any allergies? Alright, that's perfect. Thank you so much. Now just give me a few seconds. Let me have a look in your chart, and then I'll be right back. Okay, but please don't get up from the bed all alone. If you need any help, just let me know. Okay, I'm just next to you. So read the form now. Read the form because this form can be anyone. कोई भी फॉर्म आ सकता है आपको पेपर में, तो हमें हल्के में नहीं लेना है. कोई भी फॉर्म को आराम से उसको देखो, जरा देखिए, पढ़िए, समझिए, टाइम लीजिए अपना आराम से. And once you will have a look in the form, then come back to the patient. As I already learned this form, मैंने already learn कर रखा हुआ है फॉर्म, आपको भी learn करना चाहिए इस फॉर्म को, तो आप directly पूछ सकते हो. So can you please tell me who brought you to the hospital? Okay. So do you remember today's date? Okay. So what you had in your breakfast? All right, that's perfect. So like, have you experienced like your sleeping pattern, your eating pattern is disturbed? Yeah, nurse, it's completely disturbed. Okay, so what about the reason behind it? What do you think? Sometimes we feel headache all the time. So are you also experiencing any kind of headache because of that you're not able to sleep? Yeah, that's true. Okay, and what about eating patterns? You said that they are also disturbed. So are you experiencing any kind of nausea? Yeah, I've seen in the file that you're experiencing, but I just want to know the extent, how bad it is. So nurse, it's like very bad. I'm like experiencing a lot of nausea and vomiting. Because of that, I'm not able to eat. Oh, well, that's fine. Don't worry. I will refer to the nutritionist, and she will develop a good nutrition plan for you according to your needs. Okay, so don't worry about that. Okay. Other than that, I just want to know that are you experiencing agitated or anxious like all the time, or like without any reason you're experiencing such kind of feelings? Yeah, sometimes, not all the time. Okay, well, that's fine. That's fine to me. Okay, so now is that okay if you can hold my hand? Okay, that's fine to me. It's just because of my assessment part. So please, the door is closed, privacy is maintained, and I took your permission. So I hope it is okay to you, right? Okay, so can you please hold my hand? Okay. Yeah, I can feel that you are a little bit sweaty. It's a proximal sweat. Okay, so is your hands like tremor when you don't touch things? Like, anyway, anytime. Yeah, sometimes I feel like my hands are, trembling. Okay, so because of that, have you like lost your job, or, because if our hands are trembling, so we won't be able to do some skilled work, right? So are you also experiencing such kind of things? Yeah, nurse. I was a nurse. I was, used to give injections and all, but now I can't do that because my hand, start shaking. Okay, that's fine. I will share this finding to the physician. Okay. Now, lastly, I just want to know. Sometimes people, when they quit alcohol, they usually experience, something that I can't see, but they see something unusual. So, are you also experiencing such kind of thing? Yeah. Sometimes I feel like somebody's like, walking on the tree, crawling on the walls, like that. Okay, so are these things are demanding in nature? They are asking you something to do? No, no, no. Okay, so no auditory, right? Yeah. So only you can see them. And what about on your body? Are you experiencing something unusual on your body that usually people can't do or I can't do? Yeah, I feel sometime, the ants are like walking on me. I feel like itchy all the time. After taking bath, I feel itchy. So I feel something unusual on my skin. Okay, don't worry. As you said, you feel itchy, so I will refer you to the a dermo consultation so that they can come and have a look. But I will also share this thing to my to your physician, just to rule out the main cause. Okay, is that okay to you? All right. So, well, I'm done with my assessment. Just give me a few seconds. Let me do my charting. Okay, all right. Okay. So, guys, now it's time to do the charting. तो आप उस फॉर्म को फिल करेंगे. फॉर्म को फिल करने के बाद what you have to do? सिंपली आपको क्या करना है? आपको स्कोर करनी है. आप देख सकते हैं फॉर्म के ऊपर वाले पार्ट में स्कोरिंग लिखी हुई है. आप यहाँ स्कोर करते चले जाएंगे. अगर स्कोरिंग का मैं डाटा बताऊं कितने का स्कोर, तो आप देख सकते हो 0 इज नन, 1 इज माइल्ड, 4 मॉडरेट एंड 7 इज सिवियर. दैट्स ऑल. हर किसी में यही है. 147 147, 147 147. सो इट्स लाइक माइल्ड, मॉडरेट एंड सिवियर. तो मैंने देखा कि उसको नोजिया वॉमिटिंग तो काफी था. So what I will do, I will just score 4. Okay, so I will score it 4. Just give me a second. So the score will be 4. Tremors थे, but उस टाइम पे नहीं थे, but वो कह रहा था कि मुझे आते हैं tremors whenever I do something, some skill work. So it will be like 4. Proximal sweating, yeah, it was there. Severely थी, क्योंकि बिना रूम में AC चल रहा, उसके बावजूद भी sweating हो रही है. Anxiety हाँ था, थोड़ा सा agitated भी था. Tactile disturbance, yes, itchy था वो. Auditory, yes, it was commanding in nature. Yeah, it was not that commanding, but it was there. Visual था, but not commanding. Okay, headache, हाँ उसको headache है जिसकी वजह से वो सो भी नहीं पा रहा है. Orientation तो ठीक थी, not that disturbed. Guys, do the total score. Total score करने के बाद आप यहाँ नीचे आएंगे तो आप देखेंगे कि पेशेंट को माइल्ड, मॉडरेट और सीवियर में आपको करना है. तो आप इसकी स्कोरिंग अपनी जो भी स्कोर आपका आ जाएगा, इट विल बी लाइक सीवियर. Okay, and do your signature here. Do your signature like Vaishali. Okay, and then afterward you have to do management. Management में क्या बोलना है? As you are not able to sleep, I will provide you calm and quiet environment. Okay, and whenever you feel dizzy or whenever you feel like nauseated like a lot, so usually we feel like dizzy, after like after the loss of lot of fluids. So please don't get up from the bed all alone. Your safety is my priority. Okay, so I will put one sensor pad under your bed sheet, under the footsteps, so that whenever you move or whenever you try to move, we get a notification and we can actively come and help you. Okay, and other than that, I will also make sure that you have to drink enough water, because sometimes because of alcohol, we patient experience UTI, urinary tract infections, because alcohol usually flush out all the water from the body and make it dehydrated. So we get a chance for we get prone to UTI. So just to prevent that, please drink enough water. Okay, that will definitely going to help you. I will also refer you to the nutritionist to maintain a well balanced nutritional plan for you and reorient the person. जैसे कि उसको उसको जो orientation तो थी, बट स्टिल ही वाज बिट कंफ्यूज, थोड़ा थोड़ा था कि मैं अजीब सी बात है ना, लाइक विजुअल टैक्टाइल विजुअली डिस्टर्बेंसेस, टैक्टाइल डिस्टर्बेंसेस, तो वो कंफ्यूज हो सकता है, तो उसको रीओरिएंट करना है. whenever you feel something unusual on your wall or on like that, then please let me know. I will come and you can talk to me. Okay, so we have to reinsure the patient again and again. And that's all, guys. Then after you, we have to mention, I'm just next to you doing my documentation. If you have any concerns or if you need any help, please let me know. Is that okay to you? Full stop. Do your hand hygiene and stand or sit over there. That's it. Is that clear, everyone? So ये था हमारा अल्कोहल ऑडिटिंग का स्टेशन, विच इज नॉट दैट डिफिकल्ट. बस आपको एक बात और बोलनी है यहाँ पे, जो कि आपको हर एक रिस्क असेसमेंट में बोलनी होती है. दैट इज, आई विल चेक योर वाइटल्स एट द एंड ऑफ द स्टेशन. ये कब बोलना होता है? ये हमेशा हम ओके, सो लेट मी चेक योर आईडी. ओके, लेट मी चेक योर आईडी. उसी वक्त हम पेशेंट को बोलते हैं कि आई विल ऑल्सो चेक योर वाइटल साइंस एट द एंड ऑफ द स्टेशन. आप लोग वाइटल्स चेक नहीं करते हैं क्योंकि ये वाइटल चेक करने का स्टेशन नहीं है, बट आप पेशेंट को मेंशन करते हैं that I will check your vitals at the end of the station. I hope it is clear to everyone.